Welcome back. I'm Julia with American Frontline Nurses, and tonight we have got a special guest, Dr. Jennifer VanDeWater. She is the People's Pharmacist, and she's also a good friend of mine. So I'm going to go ahead and I'm going to add Jen to our podcast. Hi, Jen. How are you doing?
Oh, good, Julia. How are you?
I am good. Thank you so much for joining us tonight. I absolutely love hearing your story. I could listen to it all day long, and I'm so glad that we get to share what you've been doing and how you became the People's Pharmacist. So thank you again so much for joining us tonight.
Oh, it's my pleasure. Happy to be here with you. Like you say, yes, we're good friends. And I love sharing my story, hoping it will empower and encourage others to break free from Big Pharma.
Yeah, and there's so much I could go down that rabbit hole because, as you know, I worked multiple different jobs for Big Pharma before leaving Big Pharma, and then I happened to go back to Big Pharma multiple times. So it's hard to get away once you get into that stronghold, and even harder when you're on the medications. And that's the thing that I absolutely love. And I'm so excited to be able to share that with our viewers of what you're doing now to help people to break free of Big Pharma. So I know how, but if you could explain how you became interested in what you're doing, and then your story is, like I said, is so amazing. We both worked in retail pharmacy for years and had our eyes wide open.
Yeah, I'm happy to share. My story began actually as a teenager out of high school. I didn't actually, at the time, I wanted to be a lawyer, which I'm really glad I didn't go down that path. And so I decided to work that summer for the local pharmacy right out of high school. I was a pharmacy technician. This was 1998, way back in the day. And I fell in love with being involved in the community, talking to the patients. And I noticed that the pharmacist I was working besides, they just didn't seem to have the same connection to their patients as I was having. And so I decided to say, well, I don't want to be a lawyer. I'm not going to be a pharmacist, because I saw a need in the community for pharmacists who were engaging in their community. So I took the long journey, went through pharmacy college. And by the time I graduated in 2006, the industry literally changed like overnight. Now, in the late 90s, I'm sure there were things happening that pharmacists from the 80s were seeing happening in the 90s. But for me, the change, I think, exponentially grew, where pharmacists were pretty much just there to dispense. And they were bringing in around that time to be immunizers as well. So pharmacists were no longer engaging with their patients, listening to their patients, following up with providers. You were there as a machine. You were there in a robotic assembly line to just check each prescription that came down from the technician who, entered the data, counted the prescription pills, put them in the bottle. And my job was just to make sure that everything was accurate. We did obviously drug utilization review. We did drug-drug interactions, drug disease interactions, but you were at a computer all day, which was not me. Like, I wanted to be out with the people. Hence the People's Pharmacist. Exactly. I wanted to be engaged in the community. I wanted to talk to the people. I wanted to give them advice. I wanted to look into what issues they were having. So that was the first thing I noticed. The second thing I noticed was advertising kicked in around that time for pharmaceuticals on TV, in magazines. And what I noticed was people were bringing in labels of, from the catalogs, or saying, I saw something on TV. They wanted to know how they can take the magic pill that was going to make them live like they were on a vacation every day, So I used to, see people and say, well, you really should talk to your doctor. And what I was really astonished with, they would leave me, go to the doctor's office, and come back with the script so quickly. The doctors were just writing these prescriptions out. And I thought, well, this really is, again, I'm watching things shift from care to now let's just keep giving people medication. The next thing I noticed coming out of pharmacy college is you're taught prescriptions equal quality of life. So I'm believing that I'm going to see that presented to me at work every day, but I wasn't. I was noticing the people on the most medications had the least quality of life. And Absolutely. I was watching them decline as more and more got added. And it was disturbing for me because when I would try to talk to my colleagues or to the patient or to providers, I was, looked at as the pharmacist that was into conspiracies, thinking that we shouldn't, over medicate the population. It is quality of life, or there's a reason for this. They eat poorly, or they smoke, or they drink. I mean, there was every excuse possible besides that they were over medicated. So I watched that. And the other part that really disturbed me was when pharmacists became, certified immunizers, because in between having to check, and again, you were a machine. You were there to just keep running them through the assembly line, getting them filled so that this way the patient could pick up their meds and go. Now you had to stop, go administer shots, and then go back into checking prescriptions. I never became a certified immunizer. I believe it was God's hand protecting me. I actually was queasy with needles, so I always said no one wants a shot from a fainting pharmacist, because I would probably be on the floor. But it protected me. I left a retail pharmacy when they started pushing certified, immunizers, and I said, I'm not doing this. I refuse to do this. These companies were willing to pay for the education, the CPR classes, the certification, but I just knew it wasn't for me. So I left retail pharmacies where retails were just profit over care. And I'll share a story before I go into where I went after that. In the retail pharmacy setting, as I watched people become over medicated, as I watched pharmacists draw away from their patients and literally just become a robot at a computer screen, I started to notice that people needed to talk. They needed someone. So I was the voice in the community, trying to encourage these people not to fill medications if they didn't need them. Like a first time medication, someone asked me a question, should I take this? And I said, well, let's sit and talk about it. These people just wanted to have a healthcare representative that actually listened and gave them the choice. They weren't just doing it because they were told to do it. It really became their choice. And that's what made them feel empowered at the end, was when that happened. Another time when I was at my job in retail pharmacy, the manager came in and slammed papers on the counter at me. And he says, you need to start filling more prescriptions. You're not meeting your quota. And I just I'm busy as heck anyway. I stop, I turn, I said, what do you want me to do? Make people sick? And as that rolled off my tongue, it was kind of like an aha moment. Like, are they sickening people so that they sell these medications? Like, it just kind of had this weird pause. I didn't have any evidence of it at the time, but I just thought, that's really weird. And so after, very short-lived career in the retail chains, the retail drugstores, I ended up switching to independent pharmacies. I actually was wondering if I should even still remain a pharmacist, because I couldn't stand big pharma chains. I couldn't stand the pressure that was there, the way they treated their patients, the way they lied to you in an interview. So here I now go to an independent pharmacy and realized these independent mom and pop pharmacy owners care about the community. It's more of a family feel, a good environment. They want you to engage with the customer. They don't want you to stay behind the computer screen. They want you to be who you are. But what I noticed, which drove me nuts, was the overreaching arm of big pharma coming in through the insurance companies, which I'm sure you saw as working in retail pharmacy. These insurance companies put a stranglehold on these independent pharmacies. Reimbursements were so low to the independent pharmacies as compared to the pharmacies that were the retail chains. So they were not getting paid enough money. And then the independent pharmacies succumbed to the medication therapy management, the MTMs, because they were getting paid every time they answered yes to these insurance company requests through MTMs. So I'll explain for your viewers if they are not aware of MTMs.
I don't think they are, because it's something that I actually learned about from you. Talking to you about it, because I worked in the early 90s. I worked for Long's Drugs, and I worked my way from, a cashier all the way up to, at the time, we didn't have to have a license to be a pharmacy tech. It was, back in the 90s where I was right out of high school, like you did, and I worked for Long's Drugs, and I was back there. You know, I wasn't filling the prescriptions because at that time it was the pharmacists were still filling them. They were still counting everything, and they were still putting them in the bottle. But I was in the back typing the prescriptions out. And this, what I've seen over the course of the last basically 30 years of what's changed, it's nothing like it was 30 years ago.
And I think when you were there, MTMs did not exist. MTMs kind of came in the late 2000s, I want to say, around that time. And it was another scheme from the insurance companies how to end independent Main Street America, pretty much, and give the profits to the pharmacies, the big chain pharmacies, and also still control the people. So as people left the big chain pharmacies and went to independents, they were still using their insurance companies because that's what we all do, right? So now they figured, well, we still have to have some control over these people. And so the insurance company, someone sitting in the office is going through profiles, comparing med charts to pharmacy charts and saying, oh, look, John Smith, he has type 2 diabetes. Oh my goodness, he's not on a statin. We're going to send a fax to the pharmacy. And in this fax, we're going to let them know that we've noticed that this patient is not on preventative cholesterol medication, and he has all the, disease states that make him qualify to be on this medication. So the fax comes over. Most pharmacists look at it and they send it off to the provider. The provider gets it and says, oh yeah, go ahead and fill this. I'll write a script for him. Sure, no problem. Once that gets sent through, the pharmacy then gets paid, because they did what the insurance company wanted. Now, I was the opposite pharmacist. I could not stand these. I was like, wait a second. The patient's not even at the office. Like the doctor probably checked their levels. Like I had all these questions running through my mind. And so when I would see these, I was like, I'll do them. And I know that my boss probably was like, no, don't let Jen touch them. We're losing money with that girl. And I would actually call the office and have a conversation and educate the providers on what I was seeing on my end and ask them, hey, does your patient, Mr. Smith, how does his labs look? Do you think, well, he seems to be pretty good, and okay, let's not add this. I'm going to put down that we've discussed this and we're not going to add this medication. Okay. So when I would respond to that MTM saying, no, we would not get paid. But every time you responded back that you showed them that you filled that prescription, the pharmacy would get paid. Now, I'm sure that the big chain pharmacies probably got a lot more than the independents, but they were getting anywhere at the time $60 to $80 every time that we agreed to one of the insurance companies' request of therapy change, therapy, increase, add a new drug, any of those. It was always, we would get paid. But I was the one who was trying to do everything I could to be an advocate for the patient, for their overall well-being, and not to over-medicate them, because that was the one thing that I just could not stand. I was like, these insurance companies are just trying to make money. At the time, that's all I thought it was about. But then as I've learned through the years, it is just to keep the people sick. More medications, your body's not healthy. So as I watched that unfold, my last independent pharmacy I worked for had a retail setting and a long-term care. Long-term care is when all the puzzle pieces kind of came together for me, because here I was packaging meds for assisted living facilities, the elderly in our community, and also boys and girls of teenage years in troubled homes, troubled facilities that they were living in. But these kids were on so many medications, such high doses that I would think that they'd be sitting in a chair drooling all day, that there's no way they even would be interacting. They were so highly over-medicated. I was just floored when I actually started to see the packaging that we were doing. And then when I would go to the elderly people, no wonder they were falling or, incoherent, because the medications were dosed so high. So I started again, who I am. I started talking to the nurses at the facilities, started calling the providers, started trying to advocate for these people, because I just had a feeling that they were just on too many medications. And that's probably why they were having all these other issues. And sadly, every time someone had an issue, what do? They just add another drug. They don't think we can diminish some of the drug load. They just add more. And for the people in the community, I used to take them aside and I'd be like, hey, your mom, I mean, she's 88 years old and she's on these cholesterol meds, these acid reflux meds. And, I've seen her come in with you before and she's a tiny little thing. Like, does she need all this? And she says, I'm really glad you said something because I question this. But every time I ask the doctor, he tells me this is what she needs to be on. She's been on it all this time. We're not going to take her off. I go, well, maybe you can have them reduce her doses. And I said, have them call me if they want. Most times these doctors never reached out. Most times the patients I was trying to give them the information, to have them be empowered to ask their provider the right questions. Sometimes the patients would come back and say, hey, I got my mom off one of the pills. Great, but I noticed it was a really hard battle. So the end of 2019, I just realized I was a better advocate if I was actually at the doctor's office. If I could prevent that script from being written, I was then actually going to save that patient, help that patient, rather than to actually have to fill it and then try to get them off the prescriptions.
Exactly.
It was harder. It was hard. Once they're on, they're trapped. It's like Hotel California. You can't come off of these. And so like, if I can stop this before it gets to that point. And so the beginning of 2020, I started reaching out to some local doctor's offices. And one of them said, actually, we have a part-time position opening up in June. We'd love to have you come on. We've talked to you many times. We love your recommendations. If you could be our pharmacist, that'd be great. I said, sure. So I put my notice in, figured I'd have a little bit of a gap in 2 jobs. I could actually do some research and get prepared to be in a completely different role I was going to be in. March, COVID took place. And I got a call that job was terminated. That position was no longer available. And I watched from the sidelines as everything unfolded. And I was just dismayed. I said, wait, what's happening? And it was like everything just went upside down, everything I knew in pharmacy. And at the same time, I was not working. I started digging and doing research because I said, something's not making sense here. And I started going down the rabbit holes of the Rockefellers, the Flexner report. I watched The Truth About Cancer. And when I started to really do my research, I sat back and I thought, I can't go back into that industry. How can I now go back? I had an inkling something was off, but now that I'm seeing it and knowing it, wow, I just can't believe this is what's happened all these years. And how dare Big Pharma convince me that I'm out here saving lives when I'm actually hurting people? So it was a real eye-opening moment for me. And in that moment, I realized I'm not going back. I've got to advocate for the people in a new way. I live in a very rural area, so the possibilities of working at the doctor's office again, where everything got shifted after COVID, nothing went back to the way it was. But through my journey, through many things of the past few years, I realized I was better to just meet with the people and work with their providers. And so I have a ministry called the People's Pharmacist, because because I answer to the people. I don't answer to Big Pharma. I'm here to advocate and be a voice for those who feel they don't have anyone listening to them or understanding the things they're going through. So I'm very happy to, work with people, figure out baseline. A lot of times there's simple things that can be done. A lot of times the body's just been out of balance due to diet, lifestyle choices. We really actually are designed and created so well that we can heal on our own. We really don't need the help of pharmaceuticals. The majority of time, we don't need that help. And so it's actually amazing when we can take ownership of our health, be empowered, and realize there are natural solutions out there for us. And so I'm here to be a voice for the people and hopefully give them encouragement so that they can make the best decisions for their well-being.
And I absolutely love that, because there's so many things that medications that people don't realize. They are taking, like you said, they're taking one medication and it causes something else. So then they're on another medication. And it's that snowball effect where they start with one and now all of a sudden they're on a dozen different medications. My parents are a prime example of that. My mom is diabetic and she started out with metformin and
Yep.
metformin. And we discovered that metformin wasn't dissolving in her stomach. Her body was just passing through it. It took us a while to do that. So because of that, her insulin resistance kept getting worse and worse. And now she is basically, she's type 2 diabetic, but she's insulin dependent now because they lovely, I'm not going to say it starts with a K, ends with an R. Unfortunately, that's her insurance. And instead of getting to the root cause of what was actually happening and the fact that the metformin wasn't working, they just put her on insulin. And now she's been on insulin for over 10 years. And
Wow.
she's completely dependent on it now. We did, because I am like you, I've gone down the rabbit holes, and we joke, and my husband says I've got fox dens in the rabbit holes.
Yeah.
I get into, I'm like, okay, well, I'm gonna research this, and I just dive in, and I'll just keep digging and digging and digging in one thing. And I've found that different medications will strip the magnesium from your system. They will strip the calcium. They'll strip things from your body that your body needs. And the doctors aren't telling people that if you're taking, prescription XYZ, you need to supplement with this, or, and to what, and they're not monitoring that.
And another problem, Julia, in talking with other pharmacists that do study this a lot, like functional med certified pharmacists, we have conversations. They say even if you supplement, your body can't absorb it because of that prescription.
Yep.
So it's really, it's like you can't win on a pharmaceutical. Like you're not going to win. So if your body's being depleted of a nutrient due to being on that pharmaceutical, even if you supplement, your body's not going to absorb what it needs to get that level up. It's interfering with the whole process. And when I heard that shocked me, because that's what you're saying is exactly how I was like, okay, you're going to be low in this, so now you got to take this, and telling people, but now it makes sense why they weren't getting healthier, because their body was still not absorbing what it actually needed to be healthy.
That's new. Like, that's something
right?
new I just learned, because it makes sense when you said that. It makes sense. It's like, okay, if it is stripping it, it's not allowing the body to work properly. Right. So I'm going to have to get back on my mom and be like, okay, we got to do some more stuff, because we did get her off the metformin, and she started taking berberine and quercetin. She lets me know. She's like, I need my quercetin because I order it for her because I get a discount on it, and I just have it shipped to the house. She's like, okay, we're going to do a big order this time because it's on sale. She's so funny about it, and I'll order stuff and send it to her, but I'll have to get with her and let her know, like, we may have to have some, do some adjustments, but she's doing so much better with all of her sugars. And she's actually been able to reduce the amount of insulin that she has to take, because she's being more careful with the natural stuff, and she's trying to get off the prescriptions. And,
it's a journey.
It is.
I mean, people just, I think that because, people hear this for the first time, their first thought is to panic. And I want to say, don't panic. Your body is amazing, and it's adjusted to you being on these pharmaceuticals all the years you've been on them. So that's the first thing, is you can't just turn around and dump your pharmaceuticals out and say, I'm done. I don't want to take these because now I know they're bad. Well, your body's worked around to adjusting them. So coming off of pharmaceuticals, well, first of all, it's one at a time. It's not just taking 3 and saying, well, I'm going to start with these 3, because if ever there's a reaction, you don't know where it came from. So you start with 1 and you work your way through each one with the guidance of a provider. Especially be great if the provider who actually prescribed these for you knew you wanted to come off, and you could work with the provider to say, listen, I don't believe I need, like, I'm on 5. I think I could eliminate 2. Let's work on these 2. And so people need to realize it's a journey. And then it's not just coming off the pharmaceuticals. So what was the root cause? What caused the issue to begin with? A lot of times high blood pressure isn't a heart problem. It's anxiety, stress, or worry. And it causes your blood pressure to go up. And then they throw you on these blood pressure medications that do affect your heart. And then now you're going to a cardiologist. But if it was just about learning breathing techniques, learning movement, just getting out there and getting out in nature, sunlight, walking barefoot, all these things would decrease some of that stressors on your that you don't even realize you're doing. And one thing people don't realize, and not taught this in college either, we have the ability to control what we think. So,
oh, absolutely.
Right? And instead of letting your mind run amok, which we all get trapped in, we're all guilty of it. It happens. But it's realizing when you get caught, say, oh no, I'm not going there, because I know that that's going to trigger anxiety. I know that's going to trigger depression. I know that's going to trigger worry and stress and whatever else comes with it. And that's not taught. And then the doctors, when a patient goes to the doctor, they don't ask those questions and say, well, are you, I know it's getting like dark earlier, so you're probably not walking every night. It's getting cold, but you stopped walking. Oh yeah, doc, I did. That's not happening in conversations. It's just going to that script pad and writing that prescription. And then the patient is believing, because they've trusted their provider, that that's going to help them. And it's just a Band-Aid over the real issue, the underlying condition that's really taking place with their health.
That's exactly it. And it's we can talk ourselves into being sick. I mean, right. I've done it. I mean, I've done it myself, and it's, you stress yourself out so bad that you can make yourself sick. And with the way providers, their time now, they don't have the time. And you're lucky if you get 10 minutes with your provider now. And they don't even have the time to ask you, what your lifestyle questions are or any of that stuff anymore. Or you're doing a telehealth. And telehealth works for some things, but it doesn't work for everything. Right. And it's so sad to see what's happened in the last 5 years with healthcare. When I became a nurse and what it is now, it's so different. Absolutely so different. What I went into the medical field thinking I was going to be able to do is nothing like what I'm doing now. And it's, I never thought I would be having to fight for proper care for patients.
Right. It's like, right. Exactly. Did you think you'd be an advocate more than a nurse? I never thought I'd be an advocate more than a pharmacist. It's like, when you start seeing it, you're just like, wait a second, this doesn't have the patient. The patient's not first. The patient's not the object here. The object has become big pharma, big medicine, insurance companies, profit over care. And when you actually are in it, like you were in it and you've seen it in both industries. So you worked for big pharma, and then you also, as a nurse, you work for big medicine. You're seeing it on both sides. It's disastrous. And then when you stop and look at photos from the 1970s versus today, you understand why our population is so unhealthy.
Absolutely.
It's just like you can see, and people have come here to our country, and they talk about how we look unhealthy, unfit, unwell. And it's like, well, wait a second, what is it? Well, our food, our pharmaceutical industry, it's all around us. And then if you're not connecting mind, body, spirit, which we haven't really gotten to the spirit part yet, you need to know that you have a healer, someone to go to. And that is completely, like, you can't even bring that up in college. I am like, it is not even, like, you can maybe talk about what you're thinking a little bit. Definitely the body is discussed, but the body is discussed in compartments, but it's actually all connected, and then to think that we were created and designed so well. Oh, no, that's not how it happened. And to actually understand what has been given to us through creation to help us actually be well and live well.
And that's exactly it. It's, I was at work yesterday because I have gone back to full-time work again. And I was talking to somebody yesterday, and she was she kept saying, I can't. And I stopped her and I said, stop. I says, do me a favor. Take the knot. She kept saying, I cannot. And then I can't. And I'm like, stop. I'm like, you're telling yourself that you can't do it. And you have to change your mindset of how you're saying it. If you want to do something, you say, I'm going to do it. I can do it. Don't tell yourself I can't. Don't put that negative energy into what you're trying to do, because the more negative you are about it, the more the universe will give you the negativity. And I've seen it in my own health and my own life and my journey and what
Yeah.
I've done. And I've seen it in other people. And it's so there's the mind, body, spirit piece is so connected. And it's absolutely missing in medicine. And
Yeah.
my coworkers are like looking at me like, what is going on? Because I'm new. I've only been there a month, and they're like, whoa, like this is not what we weren't expecting to have like a service on it. It was a Sunday. I'm like, stop. Just like stop right now.
Yep.
It was
Yep.
kind of funny, but I remember I was the odd duck in nursing school, and because I was already into like my healing of myself when I finally went back to school to become a nurse and to change careers when I did. And so, I'm using essential oils and using plant-based
Mhm.
medicines and, natural things, and questioning the pharmaceuticals that we were,
Right.
that we were learning about. And, I think I'm the only one out of my nursing class that feels the way I do. Because if they do,
Yep.
they definitely don't let me know that they feel the way I do, because I'm so outspoken about it, but nobody else says anything. But there's just I know there's just so much stuff that we can change just by the way, just in little things. And like you said, it's not one medicine. It's not throwing away all the medications. It's one prescription at a time,
Yep.
uh, and working with an experienced provider that's able to do that. Like, and that's something that I love and trust with you, is that's something that's your heart, is to
Mhm.
help people to be able to do that. How would our viewers, I've put the People's Pharmacist, your website up on the ticker, and then we also showed it. Your other, how would they connect with you as on other platforms? I know you've got Telegram, and I
Mhm.
love your messages that you have on Telegram. I look forward to it in the morning because you're East Coast, I'm West Coast, and you usually
Yeah.
have them posted by the time I get up in the morning. So I usually hop on there and I'm like, okay, what good vibes is Jen putting out this morning?
Yeah, I tried to, when I created the Telegram, and that was October of 2021, it was at a time when I noticed everything that I saw at that time that was out there was just feeding the fear. Again, it's what
Mm-hmm.
we think we become. So if you're going to feed fear, you're going to live afraid. And we need to live encouraged. We need to live, motivated. We need to live empowered. And we are equipped with everything we need. God gave us everything we need. We're not lacking in anything. So that became my voice. I had some friends say, because I would tell people things, and they go, "You should have your own channel. You should have your own channel." I'm like, no one's, who's going to want to hear this stuff? I had no idea, but I started it, and then people are like, "Oh my gosh, you're like a breath of fresh air." I'm like, really? Because I'm
Mm-hmm.
just being me. I'm just telling people what I feel is helping me be who I am. Because I mean, we've talked about this, Julia. We've had some pretty rough days,
Oh yes.
and I had to find the strength within myself through prayer, through walks in nature, through family and friends, to say, I'm not staying here. I'm rising above it. And it becomes a choice. It becomes a choice to say, I can, I will, and I am. And then through that, you can overcome the obstacles that are being thrown at you. It doesn't mean it's going to get easy. The challenges are still there. Happiness is a choice. It doesn't revolve around our circumstances. And so that's where the Telegram channel kind of came from. And so it is very upbeat, motivational, encouraging, some natural tips and some jokes every now and then to pick on big pharma. So yeah, that one's the one I started a long time ago. I'm also on Twitter, and Twitter, you can be a little more edgy. So I
Yes.
try to find the edgier side of me and, post a little bit that's like, just edgy and a little more that I would never put that in my Telegram. My Telegram is the sensitive, sweet side of me. And it's kind of funny because I didn't think I had an edgy side until I started posting on Twitter. I'm like, well, I can post this there. This fits that. Perfect, because I'll see it and like it to myself. I'm like, ooh, that's a good one. And then I'm like, I can put it on Twitter. And then I do have a Facebook group called the People's Pharmacist, where It's new, and I'm trying to remember I have it because I'm posting on all these other places, and it does become overwhelming. But I do try to post some health tips. I posted recently how to make homemade ketchup, because ketchup has a lot of sugar in it. I actually bought all the ingredients and never did it. So I actually just threw my sun-dried tomatoes in the freezer. I looked up to make sure I could freeze them. I was like, they're going to go bad, and I want to make my homemade ketchup. So yeah, I threw those in the freezer, but I really want to make homemade ketchup, because I usually don't use ketchup, but maybe it has been because of I didn't realize try, to have some homemade ketchup. So I'm going to make that. But yeah, I try to post things just to give people tips and, ways that they could do some digging. I don't ever want to become someone's search engine. I don't want someone to say, well, Dr. Jen said this. No. I'm just sharing information that I'm learning on this journey. Everyone has to do their own research, decide for themselves, make the choice for their body, their health, and their wellness.
Exactly. And that's what I absolutely love about you, is you don't force things on people. You don't say this is the only way you can do things. You give people a chance to think for themselves, and you give them options. And you give it with love. It's when we met, it was just like instant connection for me. Just like, oh yeah, she's a good one. she's a good one, and she's one that I want to keep around. So
yep, same with you. I knew it. Do you know when you find your people?
Yep, you do.
You just do. You just really do. No matter what happens and along the journey, and you just know, like, we're on separate coasts. I'm on the east and you're on the west, but it's like there's so much going on between our lives that's so similar, that I love that we share different things, and help each other. And it's just encouraging to know we're out there. And that's what I'll say too, is, a lot of people can look at 2020 in the negative, and we have had a lot of tough times, but through it, the way that information is now being shared, the connections that are being made, I mean, there's a lot of blessings when you actually stop and take a moment to look at it.
There absolutely is. And AFLN, Ask a Nurse's podcast, all of this would have we wouldn't be here right now if 2020 didn't happen. And Nicole going to New York and experiencing what she experienced. She saw it in the hospitals. I was doing dialysis, and I was getting the lucky ones that made it out of what she was seeing in the hospitals. I was getting the lucky ones that actually made it out and got the REM and, that deadly cocktail. And some of them did okay. In the 9 months that I was doing dialysis through COVID, before I finally threw up my hands when, things got really bad and I left bedside, I think, and I was thinking about it the other day, I think we lost close to 15 long-term patients that had been in the clinic for years, had been going to the clinic for years. And they, if they went into the hospital with it, we never saw them again. And the new patients we were getting were the result of REM and that nasty cocktail, because it was shutting down their kidneys. And they started having, they're on dialysis if they're still with us.
It's just awful.
It's just so sad to think back what we dealt with back then in 2020 and where we're at now. I mean, it's still happening. We still get the emails, we still get the messages from people that, I got a text message the other day from a good friend that his daughter's father-in-law is in the hospital, and they were wanting to give it. And I'm like, no, like, please, no. And it's just, but I wouldn't have the community that I have if 2020 didn't happen.
Yeah. And we're making people, like, we're actually helping and guiding people so that they're going to be healthier for generations to come. We've gone through the curve of, like, we're healthy and we've been declining. Well, I feel we're coming back up as people are owning their health, as they're becoming aware of big pharma and big ag, and all these bigs. We see it on every level of society, that people are standing up and realizing what's going on, realizing who the tyrants have been this whole time. We've just been going to work and doing our job and living our life, and not realizing that we've been pawns in their scheme. And now we're like, whoa, not happening anymore. And more families are homeschooling, more families are homesteading. People are going to farmers markets. We're crushing the bigs so that they can no longer have power and control over us. And through doing that, we're becoming healthier.
We absolutely are.
And then we're training the next generations to come how to do that, because we've lost the ability, because we've become dependent on the grocery stores and on the medical profession, on big pharma. We've become dependent on somebody else to tell us what we need, instead of us realizing we know what we need. That critical thinking was just turned off. We just would go and buy junk food and think, well, it tastes good, and not realizing you're poisoning your body. You're not helping your body. You're making it harder for it to do its everyday functions. And you wonder why you're not sleeping, and why your skin's not glowing, why your gut is always in turmoil. And it's like, yeah, well, that's what they've done. And then you go to the doctor, and when they write you a script for one of their big pharma, it's like all of it's tied together. And until you actually step back and take that view and look at it and say, oh my gosh, they're all playing together. And wait, I'm the one they're playing with. Oh, and yeah, and you have to just take ownership. And it really, my thought is this too. We've become so dependent on somebody telling us what's wrong with us and what we need, that even though I'm doing everything out of love, I never want to become somebody's choice. Like, I don't want to be, well, she said, I never do, because right now my heart's in the good place, but I want to train the mind to think for itself, so that gets passed on for generations. Because when the next Dr. Fakey decides to jump on stage and tell everybody to put on 10 masks and get shots, people are going to go, oh, we've been here before, not happening. Because then they're going to see it and know it, instead of getting caught up on somebody else telling them what's best for them. What works for me won't work for you, won't work for someone else. Everyone needs to know what their body needs and start paying attention to their body. And everything's connected. So if you have a headache, it could be from something else. Everything's connected. So it's really coming to the root cause. And it is the spiritual part. We have to realize that we are spiritual beings. We have an aura that nobody can see. Some people might see it, but there's another part of us that shows who we are. And we want that to shine just as much as we do. So when they tap in and do things, we can become, down, and that affects everything about us, every bit of us. We're energy. I think that there's so much we can go into here, Julia.
Oh, there is. There's so much. And like you said, the energy. I've been in the room where someone can walk in the door and just the whole energy of the room just totally shifts, and it can go from great to terrible. Or it can go the opposite. Somebody that's bubbly like you, it comes in, walks in the door, and it can go from just to, just explosive, and it's just joyous. And I've seen it go both ways. And
too.
It's so true about energy and our the way we perceive things and what we put out to the universe, and how our bodies can be affected from that.
Yeah, exactly. And people out there say, well, how can we be energy? Well, we need electrolytes. So that's the first thing. EKGs, EEGs, and have you ever, had static and touch something, you get shocked. So there's energy. It's there. We are energy, and we need to have, ourselves in the good energy, not in the bad. There's, it really is. And again, it's stuff that you're not taught. You're not taught that in school. And that's the thing too. If we are energy, and I know you've posted this about the pets, your pets can sense things too.
Oh yes.
And right. If we're all feeling it, think about, obviously we're here on our computers, but it's transmitting something to our bodies that we're not sensing or feeling in this moment, but it is, our cells are reacting. And I really believe that if we can tell our body, just like you said with that patient of yours, we can tell our body it's going to be okay. If we can tell our body we've got this, if we can give our body what it needs, because if we think it here, it doesn't come out here, our whole body's going to know. So we've got to have that connection. Everything's connected. And
Yep.
that's something you probably weren't even taught that in nursing school. Like, oh, we're going to study this part of the body today and that part. But none of it was like, it affected the other parts. Like
how it works.
Yeah.
I actually was talking to my mom yesterday about my dad needs to have some dental work done. And I'm like, Mom, we need to, you need to make that appointment because the teeth and the meridians, people don't think about it. You have a tooth pulled. Well, that could affect an organ. It could affect your back. It could, there's so many pieces because we are connected, the way we're connected, the way God created us to be a whole mind, body, spirit, and how we work. Having an organ removed, having things, you have gallstones and gallstone attack. The first thing they do is they yank the gallbladder out instead of getting to the root cause and figuring out what is causing that. They just go in and they're like, oh, it's a quick, in and out surgery. But then you don't realize that, okay, now I have no gallbladder. But what is that going to do for the rest of my life? It's going to completely change the way I eat. And they don't, I know this for a fact. My brother had it done not that long ago. With it, it was an emergency surgery. He wasn't able to prepare for it or anything. And now they didn't teach him the way, you have to take the enzymes, the different things for, to be able to process foods properly now, because he doesn't have the gallbladder that makes the bile salts and all of that. And, we have a gallbladder for a reason. We have an appendix for a reason. There's things that we have in our body because God created us the way he did for us to work properly. And the medical interventions aren't always the best way to go about things.
It's amazing how they went so quick to the scalpel and not to trying to heal and trying to get to the root cause. It was like the whole industry changed from, what did they do years ago when they weren't doing surgeries? They actually healed the body. And so now it's just like, you're right. Everything is a surgery, cut the person open, which cutting them open, that does something to your body too. Like everything that's not natural to how we were created causes a problem. Now, I'm not saying in an emergency situation, of course, yes, but just the routine of things has become too routine. It's like, oh, it's just, we're going to schedule. They're having in and out surgeries all the time. They're like day procedures now. And it's just like, wait a second, and the more and more people I talk to, I'm hearing about surgeries all the time. And I'm just like blown away. And I'm like, what? And then like, oh, we're going to give you a new knee. And it's like, well, maybe the person could lose some weight. Like they don't talk about, like, it, to me, it just blows my mind. Or if they're inflamed, it's because of the choice of food, all these things that you could really help the body heal and use that as your first line therapies. Let's do things the natural way and work through it for a while before we jump to pharmaceuticals or surgery or the others that are so invasive and so toxic. Because I'm not saying all pharmaceuticals are bad. There are some that people actually need. And we did have ivermectin and hydroxychloroquine, and they're prescription meds. So I'm not saying that they're all bad. What I'm saying is it's become the industry of just, there's a pill, instead of really diagnosing a patient after you've tried other options first.
And we could talk. I feel like we could talk for hours, because when we do talk on the phone, we talk for hours.
It goes by fast.
It does. It really does, because there's just so much with all of it. And we didn't even dive down the rabbit hole of the parasites and the detoxing and the cleansings and all of that, and ridding our bodies of the parasites and the candida and all the other stuff that people they have, and it's causing other issues. And they go to the doctor, they're not getting the proper tests done. They're getting thrown a prescription that may actually make it worse instead of making it better. They get an antibiotic for something. Well, then that's just pulling all the good and bad bacteria out of your gut. And they, as with me, when I was doing home infusion for big pharma, I would always, give the extra education if they're going home on an antibiotic, that they need to then do the the prebiotics and the probiotics and everything once they're done with the antibiotic, to build the good bacteria back up in their gut. And they're like, what? I need to do what? Like, yeah, you can't just kill all the bacteria from this IV antibiotic that you're getting and you're going to be on for the next 14 days. Then you have to, put the good bacteria back in your body. And it's a simple thing when you know it, but so many people aren't being taught that.
Correct.
And it's really sad what's happened. So I really appreciate you coming on today and going in depth with me and, digging another foxhole.
Yeah,
viewers. So.
For sure. It's definitely been a pleasure. And I'm happy to come back when you have other topics. And now that I've been introduced, we can go down other areas and really hone in on some of the other, things you just mentioned and talk about those, because that is, it's true. That's true. We have so many, there's just so much. It's hard to condense it all into a little bit of time. So.
And could you just give our viewers just a little piece on your consulting services that you offer?
So the People's Pharmacist is a private health ministry. So in order to receive any services, you have to be a member. So I have a contract I can email you so you can become a member of the People's Pharmacist. And then any of the consulting services people just even say, I started this health journey. Am I doing things correctly? So I can be a guide to say, oh, okay, what have you started? What are you doing? Yeah, this is good. Don't do this. Let's keep down that road. Just a guide. Also, if you have a provider, I'm not a licensed medical doctor. I'm a pharmacy doctor. So I can't be the one to deprescribe, but I can give guidance in what deprescribing is. And then you can take that information to your provider and tell your provider, hey, I'm on, 5 meds. I think I'd like to come off these 2. Can we start with this one? You'll have at least an idea of what information you're sharing with your provider. So you're not going in, completely lost. You're going to go in empowered and encouraged to knock those off. And then also, if people want to just have a conversation, get to the root cause of some issues, hey, this is what's going on with me. I don't know where it's coming from. We will work together. We'll pray together. And we'll find out exactly what's going on to help your body heal naturally. I can do recommendations on supplements and nutraceuticals, but I'm not for pushing one pill over another. So everything's a supplement. Everything is as needed. And we can work on balancing that out too. So it's really any type of service you're looking for, you can ask. And if it's within what I can do, my scope of practice, I'm happy to assist people on their journey.
Perfect. Thank you so much, Jen. I truly, truly appreciate this and having you on today. With supplements, American Frontline Nurses, we do have our own line of supplements that Nicole and I that we've been formulating with the mushrooms. And that's a whole nother topic that you and I we've discussed before. But they've helped Nicole and I so much, especially when we were attacked so badly the beginning of last year. It was like, that was like the only thing that pulled us out was our supplements, was taking the mushroom supplements. And they were so expensive when we were buying them from, the big box type pharmaceutical type companies, that we were able to formulate them, and then all the proceeds go back to American Frontline Nurses, so that we can continue helping people behind the scenes like we do, and not doing our, we do an occasional trip, but we haven't done a trip in over a year, or almost a year, because the money that we receive from our supplements and from our donations goes directly back to the people that we're helping. And it's just another way for our supplements that we can help other people. So that's how it's helped us. And now we're helping other people with our supplements. So I'd love to actually send you some of the mushroom ones that we've got. So we'll talk offline about that, so we can do that. But it's just, they've they've made such a difference in what we do and what Nicole and I have been doing and what we've had. It's just been incredible. So I'm just glad that we're able to offer those to our followers and to the patients that we do help. So
Yeah,
thank you
that's
again.
great. That's
Yes, thank
great.
you.
That's awesome.
I love that we're able to do that. So thank you again so much for coming on today. I'm going to go ahead and I'm going to wrap it up, and we will see you guys next Tuesday. Bye.
Bye, everyone.